years, and unlike many of you who look much younger than I am, my husband and I were self-employed, so we bought health insurance in the private insurance market for decades before the Affordable Care Act was implemented and after, so we have a real historical perspective on it. And what's up is once you reach age 40, before the Affordable Care Act, pretty much everyone I knew was considered to have a pre-existing condition. Pre-existing conditions, depending on your company, were defined from everything to once having gone to a dermatologist for having a pimple to being a woman was also considered by some to be a pre-existing condition. So what that meant was you were locked into a certain health insurance company, and that's what happened to us. It meant that decade after decade, whatever bill they sent us, we had to pay, or we had no health insurance, and we did not consider that an option. So we actually spent more on health insurance before the Affordable Care Act than to buy our house. Once the Affordable Care Act came in, it was wonderful because all of a sudden we were not discriminated against before because of pre-existing condition. We were not put in any kind of high-risk pool. We could just buy insurance like everyone else, and we had a choice of dozens and dozens of health insurance plans that we were happy to pay for. And when I volunteered at a Affordable Care Act sign-up, there were people coming in of all different income levels. There were people even coming in at six-figure incomes saying, I am thrilled to be able to finally buy health insurance. Before, I couldn't even buy it at any cost because the insurance companies wouldn't sell it to me. But so I wanted to tell you how much I love the Affordable Care Act and what a difference it has made in our county, where over 10% of the residents of Osceola County buy our health insurance from the Affordable Care Act. And the one concern I have as it goes on is seeing the provider list. Because, for example, when I look through to see if my husband's neurosurgeon and other people who he needs to go to for his health problems are covered on health insurance plans, I saw many plans where I lived pretty far west in Osceola. Some of the plans, the closest hospital was St. Cloud Hospital. And for many people, especially those with some kind of health problem, that's just too far away. If someone's having an asthma attack, you don't want to bring them to one hospital when all the records and all their doctors are actually at another hospital. So I was wondering, do you think something could be done to ensure some kind of minimal level of provider coverage, and so that your local hospitals would be covered by your insurance plan?